So we came here last class. So everyone on the line, ready? Shall I proceed?
Yes, sir. Yes, sir.
Perfect, perfect. So be on the track. Stop me at any time. Ask any questions if you have in between. Don't be like, yes, okay, I feel shy, so I don't ask questions. So let it be. Always expect to speak whatever if it is right or wrong. Don't think about others. Your confidence level speaks more. So yesterday we discussing here. We so far we understand the accent planes and joints. So when look at this picture, obviously immediately something comes to your mind. This is a shoulder joint, elbow joint, wrist joint, and neck. They were mimicking that sagittal plane motions because all the four joints they mentioned, it helps to do a movement in a sagittal plane. And then immediate next picture, you can see that frontal plane or coronal plane movement, right? And immediate next to that, we can see that radioulnar joint and atlantoaxial joint. They are mentioning that rotational plane movements which are occurring in the transverse plane. So as I said, after the axis and planes, humans will move. Our learning, very important learning, humans will always move in a rotational or oblique planes. Humans always move in this kind of planes. How can we easily say these three planes? Because we are not robots, right? We are not robots. We are not move only in a sagittal plane. We won't move in like this sagittal only, frontal only, rotation only. We can't move. It's not possible. Movement is functional. Movement is functional. So that is where this concept comes oblique plane. What is oblique plane? What is oblique? We are going to understand after this 30 minutes, definitely. Okay, just pay attention as much as possible and so clearly for next 30 minutes. Okay, any questions, stop me. Any doubts, you can't understand, sir, repeat. Turn on your mic and tell, sir, repeat, please, I don't understand. Fine. Many times you want, we can repeat. Okay. So oblique plane, these are all the planes helps to understand the axis and planes and with the help of joints. All the three cardinal planes helps to understand the joint movements. Oblique plane helps to understand the muscle movements. Helps to understand the muscle movements. These muscles are attaching to the bone and bone forming the joint. These three structures creating together movement with the help of central nervous system signaling and the energy, as we know. This summary, okay. See, module 4, 3 and 4, as I discussed, how to understand the muscle function by only looking at the muscle. That is what we are going to learn. So as we know, it's a pulling machine. Muscles are pulling machine. It contract each other. It pulls inside each other to create the moment of push, pull, whatever outside. As you suggested. As you suggested, yesterday I download this picture and I put it into my slide. Clear? Now what you are going to do? You are going to, one person have only one chance. If you now no one can answer, the person can come forward and answer. Okay? Once you answer, please wait for others to answer. Anyone answer. I'm telling. I want to know the function of latissimus dorsi now. Function of latissimus dorsi. We used to call
Adduction and medial rotation.
1 minute, sorry. We used to say action. Try to use the better term function. Okay, action function same. So action, what I mean function is action of the muscle. So Aishwarya said medial rotation, right?
Yes, sir.
Yeah. So Aishwarya said medial rotation. I want an explanation too. How we rotate medially. Okay, Aishwarya.
Yes, sir.
Any other also help her to answer. Yeah, medial rotation true, I accept. But how?
Sir, it goes from underneath the humerus, it goes forward and attaches to the big with the head
Hmm.
in forward. And then when it pulls, it automatically, when it pulls, the pulling mechanism happens. It will pull it towards the body. So internal rotation.
Excellent. So basically what, your name?
The Gibran.
Gibran, basically Gibran is explaining clearly that the muscles are coming posteriorly and coming attaching anteriorly to the shoulder, humerus. So when it pulls, it rotates internally. When it pulls, it rotates internally, inward. Can you see that? Not attaching posteriorly to create external rotation, attaching anteriorly. When it pulls from posterior to anterior, humerus, if posterior anterior, humerus will move into inward rotation. Can you able to understand everyone?
Yes,
Super.
sir.
Yes, sir.
Super. Next. If I say and, there is more function is there?
Adduction and extension.
Sorry,
Adduction and extension.
adduction and extension of the shoulder joint. Your name?
Mustafa, sir.
Mustafa. Super. Mustafa is explaining that adduction and extension of the shoulder joint. Yes, because it pulls the humerus backward. It pulls the humerus backward. When your arm is out, it pulls the humerus closer. Simple. Some of the students who couldn't able to imagine clearly, no worries. Okay, we'll repeat the process. We'll understand more clearly. Don't worry. Good job. And
It is a pull-up muscle. When we do pull-up,
no, don't stop that functional one. Yeah, pull up definitely yes. We'll come to that first because discussing basic anatomy means the muscle function. We'll come to that pull-ups definitely. Good thought process.
Sir, it also helps to do any activities by the arm which is going behind the head, like swimming or
Yeah, that is what I'm
board.
saying. The functional activity will come to later.
Okay.
It's
Functional
in
activity will
the
come to later. First, we decode the muscle by single action.
Depressor of scapula, sir.
Depressor of
Scapula.
excellent. It attaching to the scapula, inferior angle also, right? So if it pulls, it depresses the scapula also. Great, good answer. And
and it
elevates
hides
the
the
sternum
pelvis, sir.
set.
Forward
anyone. Yeah, please
It
repeat.
elevates the pelvis, sir. With a quadrant number.
Your name?
Second, Jafar.
Jafar, excellent. It elevates, it hikes the
Height.
seat attaching here, it is pulls, it hikes the pelvis, hike the pelvis, elevate the pelvis. Excellent. Super, guys. And
It enhances the movements of trunk while breathing.
no, it doesn't comes for breathing, what I feel.
Inhalation and exhalation.
No, I don't feel it. How it comes? Because it doesn't passes anteriorly, laterally. Sorry, good try.
Side flexion and rotation
Which flexion? Sorry,
of the trunk.
flexion rotation of trunk.
Lateral flexion.
Lateral flexion.
Lateral.
Lateral flexion is not possible. This muscle, for example, this muscle coming, attaching, starting here and attaching here means lateral flexion is possible. Can you able to see my cursor?
Yes.
If it is
Yes.
attaching like this, the possible chance of lateral flexion, it's going like this, right?
So contralaterally rotates the trunk.
Excellent. Who said that?
Sharan Prakash.
Excellent. Saran Prakash. Contralaterally rotate the how?
Trunk at spinal joints.
Okay.
Sir, when humeral attachment is fixed, the horizontal fibers push the trunk over opposite side.
Excellent. Yeah. Super. So look at clearly. Look at clearly here. Look at my cursor. These muscle fibers attaching to the spine. Excellent. Understand? Attaching to the spine. If this pull happen in this way, it rotate this spine in this way. Can you understand? No.
No, sir.
Back. These fibers pulls my spine, rotate opposite side. Contralateral rotation of the spine. Understand?
Sir, can you please repeat again?
Fine. This is lat muscle. Considering this is lat muscle, this lat muscle pulls. This horizontal fibers pulls, attaching to the spine. It pulls, it rotates the spine opposite side. Clear?
Clear, sir.
Yes, sir.
People answered it very clearly and excellently already. So learning the muscle. How to learn the muscle? Three information is very important. Attachments. So we need to know the attachments, right? When we need to learn the muscle, we need to know the attachment. But unfortunately, half of the attachment we need to memorize. But more than half of the muscles will give a clarity that where I'm located already. Like flexor carpi ulnaris. It attaches to the carpal to ulna. Tibialis anterior. It attaches to the anterior aspect of the tibia. Flexor hallucis is longus. It flexes and hallucis. It attaches the great toe. It helps to flex the great toe. Clear? So muscle name itself gives the clear clarity where that muscle is getting attached. Almost more than 50-60% of the muscle give a clear clarity that where the muscle is getting attached. Like random muscle like pronate teres, there is no information. It pronate, but where? But pronation movement happening maybe at the forearm. By decoding the muscle, we can get some function and attachment site where it locates. Okay. Second is function. Function we can classify into, you have to read it like this hereafter. Function we can classify it into standard mover function or standard mover action or reverse mover function or reverse mover action. What is mean by standard mover function or reverse mover function? Simply, if we used to call origin initiation before, forgot that origin initiation, just look at, think like that's attachments. Most mobile attachment, the functionally, the day-to-day life, we are using this most moving attachment called initiation, least moving attachment called origin. Okay, least moving attachment called origin. For example, if you take, for example, tell any one muscle, for example, latissimus dorsi, as we see only now before. Latissimus dorsi, which is origin, which is insertion.
From humerus, it's origin.
Humerus is?
No, from iliacus and insertion into intertrochanter.
Okay. Here we do one thing. You may know the answer, but you didn't answer because you didn't know exact location, like anatomical terms. It
So
is
many origins are
really
there,
between
sir,
two
for
ways.
this.
Sorry?
Many origins are there for this, like
Yeah,
from
many
spine,
organs are
from
there for this.
iliac crest, from scapula, and then finally getting all fibers from this getting attached almost anteriorly to the humerus.
Okay, great.
This
See,
is how it goes.
this is
Because it is a
how it's
very flat muscle, as you said. And since you thought us like what will be the name, so yesterday I went and I searched latissimus means very wide, dorsi means
got.
posterior. So that is why it is called as latissimus dorsi.
Excellent. As you said, right? But next time when you think, don't think in this way. It is attaching to the greater tubercle. It attaching to the lesser trochanter. That is where we forgot, right? That is where we couldn't able to remember the exact attachment. Someone asked where this muscle get attached. Oh, anterior superior iliac spine or posterior superior iliac spine. Just this border of that protuberance of this bone. So don't confuse like this. Do you understand what I'm trying to say? Just to keep it simple, it attaching or the somewhere anterior aspect of the humerus. That is enough to create the movement. Somewhere anterior aspect of the humerus and spine, lateral aspect of the spine, lower spine. You can keep a lower spines. How many spines you can count and you can name it. And you can see that superior posterior aspect of the pelvis. Sacrum, posterior aspect of the sacrum, like the thoracolumbar fascia and pelvis. If you keep this in simple, very, very easy. Don't try to think the border trochanter protuberance where it gets attached exactly, specifically. That is where we're going wrong. Because we couldn't able to remember. After 4.5 years of physiotherapy, if you go back and some treat the patient, you couldn't able to remember exactly where the location of the medial 1/3 of the clavicle. You couldn't able to remember, and you think that I don't know. So just we have to change that. Okay. Here attachment, standard mover action, reverse mover action. So sorry, why we did this? What is origin and insertion? As you people said, proximal humerus is insertion, scapula, spine, and pelvis is the origin. Yes or no?
Yes, sir.
Yes.
100% everyone agree? Yeah. So proximal is insertion. Why proximal? Because we use the proximal is origin, distal is insertion. Why it's reverse? Because we use our shoulder more than hiking the pelvis. Contralateral rotation, depressing the scapula. In day-to-day life. Day-to-day life, we use more shoulder extension than the depressing of the scapula, contralateral rotation of the spine. Because contralateral rotation, even though we perform, the rotational muscles are different. The primary rotation muscles are different. Lat only is not responsible for rotation. And pelvic hiking. These are all the functions we use less prominently in daily life. Shoulder movements, adduction, extension, we use internal rotation more prominently in day-to-day life. So more prominent movements called insertion, attachment site insertion, less prominent attachment site called origin. Clear? Tell me any one other muscle.
So the most moving attachment is the insertion.
Yeah, most mobile attachment called insertion, least mobile attachment called origin. That is what we called insertional. Most mobile attachment we called, sorry. Please.
Triceps muscle, sir.
Triceps muscle. Let's go triceps muscle. Good. Most mobile attachment we used to say
Insertion.
Insertion.
insertion. Also the standard mover action. Standardly muscle the movement occur in that plane, that place. So we used to call standard mover function also known as insertional attachment. Reverse mover function also known as
Origin.
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 Origin we used to call reverse mover. Insertion we used to call standard mover function. Clear?
Clear.
Now we looked at this. What is the origin of the triceps muscle? What is the insertion of the triceps muscle?
Origin will be from the scapula and the humerus.
Okay, these two things you are saying, right?
Yes, the humerus. And attachment will be at the elbow joint, on crossing the elbow joint.
Exactly. Ulna. Majorly posterior aspect of the ulna. That is called
Yes.
olecranon process. If you know olecranon process, exactly you can name it. If you are confused, don't worry. Posterior aspect of ulna. Because ulna is forming the elbow joint. Humerus is not, radius is not forming the elbow joint. So radius is not responsible for elbow movement. Ulna is responsible for elbow movements. These muscles work in elbow movement. So ulna. That's so far clear, right? So how he said that proximal attachment, like here the difference. The top attachment is called origin. The distal attachment called insertion. Why?
Because the movement is more happening in the elbow.
Exactly. We used to extend the elbow more. We used to
extend
the elbow more
Extend.
than the using proximal to distal attachment. Sir, how this movement will happen? Example, you can ask, sir, how this movement will happen like proximal to distal movement? Is possible to create the extension of the elbow? Yes, possible. If you do close grip push-up, if you do inverted push-up, distal attachment is stable, proximal attachment will move towards the distal attachment. when you try to extend the elbow. Can you understand? See, guys.
Sir, can you repeat it?
I will repeat definitely. Hope you get it. See, this is also called elbow extension. Correct? This is
Correct.
called elbow extension. Proximal fixed. This distal attachment moving towards the proximal, right? Right. Now,
Yes, sir.
now distal attachment is not moving. Proximal attachment moving towards distal attachment.
Yeah. Yes, sir.
Can you think? Close grip
I
push,
understand.
inverted push-up. So you do extension of the elbow frequently or push-ups in frequently day-to-day life activity.
Extension of the elbow.
Extension.
So yeah, that is called insertion.
Extension of
Less
the
moving
elbow,
function
sir.
called origin. Most moving function called insertion. It is not named because of the proximal distal. Clear? Each muscle it vary. Each muscle it's vary. Clear? Superb. So layering of the muscle, we know the attachments, function, we understand standard mover function, reverse mover function. Okay. Now most importantly, motion. Okay. You as I mentioned, you people are classified the movement. You people are classified the movement of latissimus dorsi. Single. Some of them try to explain swimming. Some of them try to explain lat pull down machine in everything. So one single muscle is moving means it won't move in a single functional plane. Can you understand? If it is not, please wait for the next slide. Okay. I'll explain the motion part clearly with a good example. Then you have to understand eccentric and antagonistic function. See, when you read the muscle function, when it comes to function, not only the contraction function, standard mover function, reverse mover function, and total motion, I'll explain next slide. Eccentric antagonistic function. That's what is the opposite movement of that muscle. What is the opposite movement of the muscle? And you have to understand the isometric stabilizing function. Latissimus dorsi. As we discussed the latissimus dorsi, as we discussed, the latissimus dorsi is stabilizing the pelvis and sacroiliac joint posteriorly. And it stabilizes the, what role the joint it crosses, stabilize that part. It stabilizes the lower lumbar spine. It stabilizes the shoulder joint. Triceps stabilize the proximal shoulder joint. Stabilize the elbow joint. Clear? So when it comes to function, you need to know standard mover, reverse mover, and total motion of the muscle. Eccentric antagonistic function. No worries, I will explain in detail. Isometric stabilization function. You need to understand all these 5 components. Function means not only the concentric. If you only the concentric function, if you know, you can't treat the patient in future. Okay.
Excuse me, sir.
Next Enava.
Excuse me, sir.
Please, Jafar.
Sir, the both attachment, the muscle will stabilize. As you said, for latissimus dorsi, lumbar spine it stabilized, and as well as the humerus it is stabilizing. So both attachment, the muscle will stabilize.
Absolutely.
Not only origin or insertion.
Not only origin, but origin plays major role for stabilization compared to insertion. If you have the muscle strong, you have a healthy shoulder, right?
Yeah.
You think like you have strong pec major. You have strong internal rotator. You have strong external rotator. You have strong latissimus dorsi. You have strong deltoid. Your shoulder is strong or weak?
Strong.
That's all. Strong means stabilization is good. Dislocation is there is less chance of dislocation of the shoulder.
Okay.
There is stabilization means muscles are strong. Strong. Sir, how strong muscles are weak muscles? Not. Strong means the muscle can produce the force as much as possible within available range of motion and full range of motion. Always I consider with full range of motion, muscle can produce the maximum force. That is a very good muscle. It is not like 90 degree you can produce maximum force. I don't consider that is a strong muscle. 180 degree you can produce full force. I can consider as a strong muscle. Because,
Sir,
sorry,
can we take example of quadriceps?
Exactly. Well, exactly. Super. Your name?
Sir,
Okay.
my name Aritra.
Haritra, very brilliant example. When you try to do squat, for example, you do 10 half squat and 10 deep squat. You feel twice the time exhausted when you do 10 deep squat. Because only your range of motion is increased. Your muscle work is more. We'll discuss that squat range of motion if I go to discuss in last question and answer session. Next session, we'll discuss the squat axis and planes and deep squat, what it varies and everything. Please look at and come for the next class. Okay. Thank you, Haridwar. And finally, you have to understand relationship to the other structures. What is anterior to that muscle? What is posterior to that muscle? What is lateral to that muscle? What is medial to the muscle? What is superior to that muscle? What is inferior to the muscle? More than enough. Okay. Next.
Excuse me, sir. For relation to the muscle, you are saying no anterior, posterior, lateral, medial. So what we want to look for that? I can't get it.
No problem, Sadiq. Think like you have a rectus abdominis muscle, six-pack muscle,
Okay.
rectus abdominis muscle. You learn that muscle. You want to know now what is proximal, distal, superior, inferior, and everything. What is proximal to that? What is anterior to that muscle? Fascia and fats.
Yeah.
Adipose tissue. What is deep to that muscle? Internal, external, oblique. Transverse abdominis.
Transverse
abdomen.
What is lateral to that muscle? Oblique.
Oblique.
So it gives the overview of other structural information.
Okay.
So, for example, people used to say, physiotherapists used to say, but the students, it's not relevant example for students. Physiotherapists used to say, sir, the quadratus lumborum tightness is causing pain. The trigger formation is the quadratus lumborum. Okay, that's why the patients have back pain. I beg to differ. How you first of all palpate the quadratus lumborum? It is impossible to palpate the quadratus lumborum. 4 or 5 muscles you have to penetrate first to enter into the quadratus lumborum. That deep muscle it is. Right? It's almost attaching towards the vertebral thing. How many muscles present posteriorly? You have to penetrate all the 5 muscles, 6 muscles to penetrate and reach the quadratus lumborum. Even though we don't know we reached the quadratus lumborum or not. Okay, and we say quadratus lumborum have trigger. Before that 5, 6 muscles you penetrated. What if that muscle has problem? Clear, Anna? Can you able understand the example? What I'm trying to say?
Yeah.
That is
I
where
got it.
Yes, sir. Clearly understood.
we blindly say something without the common sense. Okay, so such a relationship you understand, you can correlate with the patient. Sorry, someone asked something.
So it is physically impossible to penetrate and palpate into the dual muscle.
Isolated.
Because there are 4 or 5
isolatedly.
Right.
So now I'm not saying you can't. If you have extreme skills to do that also, only QL muscle you can palpate. And you can't say, if someone want to palpate the QL muscle, someone is saying QL muscle is causing this back pain, ask them to take the knife and do surgery, open everything, then palpate the QL muscle and stitch it again. That is only way isolatedly we can palpate the QL muscle.
Right.
Or else we have to inform the heart to please make the QL muscle most superficially, sir, because that is causing more of the back pain. So we are struggling to palpate. So next, when you born next generation kids, please make this QL muscle superficially. That is the only thing I can do. These 2 options are there. Doesn't make any sense. Anyone teaches you, just ask yourself, ask them. It is make sense. Don't believe. Even I said something, don't believe. Ask me, question. And you confirm by yourself. Okay, should I have to believe this guy or not? Okay, this guy makes sense, believe. Doesn't make sense, don't believe, ask question. Okay, so last few minutes of the class. Yeah. 5 steps approach to learn the muscle. Very, very important. Okay, when you don't know the muscle, even if only looking at the muscle, you can understand the first one. First step, look at the name of the muscle for free information. Clear? Second step, See, if you don't know about the muscle at all, fine. Just take your phone, Google it, the muscle name, look at the picture of the muscle. First of all, ask you to try to visualize yourself. Try to visualize yourself where it locates, how this fibers orientation and everything. If it is not possible, if you couldn't able to think, just see the muscle picture. See the muscle picture, it gives definitely where it attached. Now latissimus dorsi, you may don't know exact origin, exact insertion, but fine. But now after looking at the picture, you know that's attaching on the anterior part of the humerus, somewhere around the pelvis, somewhere around the sacrum, somewhere around the spine. At least you can do this, right? If you do this, you can create the movement. Clear? Third step. Clear, guys? On the track?
Yeah, yes, sir.
Yes, yes, sir.
So next 3 steps are very important. What joint it cross? What joint it cross? For example, same latissimus dorsi muscle, it crosses the shoulder joint, it has a function of the shoulder joint. It crosses the scapula, it has a function of scapula. It crosses the spinal joint, it has a function of spinal joint. It crosses the pelvis, it has a function of pelvis. The muscle, triceps muscle crosses the elbow joint, has the function of the elbow. The triceps muscle crosses the shoulder joint, has a function of the shoulder. The muscle crosses which joint has a function towards that joint. Just think this. Clear?
Hello.
Hello?
Sir,
Tell me.
so by means of spinal joint crossing, you mean to say vertebral joint, just for example, scalene, it originate from the vertebra of cervical vertebra and goes to the ribs of first or second ribs. Insert. It is 3 group of muscles.
Okay. Yeah, it has a function. With standard mover action, maybe it will rotate the neck towards the spine. Reverse mover action, it will rotate the spine towards the neck. But maybe it is difficult and impossible because of you need to rotate the entire body, neck with a reverse mover function means you need to be head down position. Maybe very least moving position. Spinal, scalene muscle helps to move the spine or vertebra. It's a very rare and difficult function, I could say, but I won't say it won't. Like for example, pectoralis. Can you able to understand? Hello.
Yeah, sir.
Yeah. For example,
Yes, sir. Yes, sir.
pectoralis major. Pectoralis major will have attachment of the shoulder joint and sternocostal joint. It moves both area. It moves both area. Like a shoulder joint, it moves as we know. It also moves sternocostal joint. But the movement is not possible because it's the cartilaginous joint. Types of joint. Because it's a cartilaginous joint, we can't expect much movement from that place. And also, when it wants to move, it has to move entire body. So producing that much force is a little bit difficult. So these are all the 2 reasons. The muscles, it is not like that muscle would move reverse mover function. Arch into insertion. It will move. Due to biomechanical compromisation, it won't. Can you understand? Okay.
Yes, sir.
Yeah, fine. Super. So
Sir.
step 4. Where it cross the joint. Where it cross the joint. If the example, if the muscle crossing anteriorly, it helps in flexion, internal rotation. The muscle passing posterior to the joint, it creates external rotation and extension. If muscle crossing superiorly, it helps in abduction. Muscle crossing inferiorly, it helps in adduction and rotation. Can you able to understand? The muscle passing medially, it helps in adduction. Muscle passing laterally, it helps in abduction. Easy. Can able to
Yes.
coordinate? No?
Sir.
It's difficult, don't worry.
Yes, sir.
A lot of practical examples are there. Once we repeatedly do, you will improve.
Sir.
Yeah,
Sir, excuse me, sir. Sir,
Yeah.
can you repeat that sentence? I can note it down. That
Okay.
anteriorly.
See,
Flexion.
rather noting down, Jafar, try to understand after the class right from your mouth, your word. If some muscle passing in front, it creates the flexion.
Okay.
Correct. So, for
Yeah.
example, pectoralis major passing front and ask the pectoral muscle to create extension.
It won't.
Beyond 0
Yeah.
degree, difficult.
Yeah.
Clear. Quadriceps muscle, ask the quadriceps muscle to do flexion of the elbow. Sorry, Flexion of the knee.
What?
Because
Hamstring.
anterior movement of the knee is extension, not the
Yes,
flexion.
sir. Okay, sir.
Okay. So where it passes, the movement it creates. For example, some muscle passing medially, it pulls. So adduction
Okay.
possibility is high. Muscle passing outward, deltoid, gluteus max medius,
Yeah.
abduction is high chance.
Abduction. Okay.
So the
So what about internal and external rotation? How are you telling that, sir?
for example, internal rotation
So
extension can be done by both anterior passing muscle, medial passing muscle, superior passing muscle.
okay.
For example, subscapular is passing anteriorly. It creates internal rotation.
Hmm.
Anterior deltoid passing anteriorly. It creates internal rotation. Because to create rotation, you can pull this way, you can pull this way. For creating rotation, angle of attachment plays major role.
Okay, sir.
Okay. And fifth step, how it cross the joint. How it cross the joint. Very, very, very important. How it cross the joint means the direction in which it is fibers are running. Muscle fiber directions. See, this latissimus dorsal is there. How you say this extension? Because this fibers pulling down. Here you can see these vertical fibers. Right? Here you can see horizontal fibers. That's why
Yes,
it
sir.
takes rotation. So one beautiful examples I can say here. You are playing tug of war with your one team A and team B. Team B was there. Both teams are playing tug of war. Team A pulling team B pulling team A. Pulling each other. Okay. So if one team pulls, another team moves, right? So is
Yes,
it
sir.
possible they will move in a front and back? Yes or no?
Correct.
Yes.
They
Yes,
will
sir.
move in a front and back. Is it possible they can move up and down?
Mm.
Is it
No,
possible
sir.
they can move side to
No,
side?
no.
Direction of pull will decide how
Exactly, because the rope in between this tuck of war decide that where they are pulling. It's the same way each and every muscle fibers you have to look at it. Each and every muscle fibers you have to look in that way. Clear? Okay, another example, when you're taking a water from the well, கிணத்துல தண்ணி எடுக்கிறோம் அப்படின்னு சொல்லலாம். Can you taking the water from the well? Is that the bucket of water move down to up, right?
correct.
Is there any possibility that water of bucket of water is move side to side, front and back?
No, sir.
Less chance. We are pulling from down to up. It will move down to up only. So the rope is like this. See, look at the rope and put it into the here. It extend. This rope will rotate. Again, these vertical fibers. So next time when you look at the muscle, don't look at the muscle. Look at the muscle fiber. You try to look at the muscle fiber, you can create the plenty of muscle function. I'll repeat again, guys. Don't worry. Okay. I'll make you understand 100%. One more. That's why I ask you to come for extra one more class. Huh? How it cross the joint? Direction of the muscle fibers running vertically or horizontally plays major role. Okay. Here it comes obliquely. It's fine. So these examples I'll discuss next class. So far, you understand this 5-step approach to learn the muscle. Okay, so for what we discussed, quickly I'll summarize and we'll stop the class. So how to understand the muscle by only looking at the muscle. You don't look at the muscle as a whole. Look at the muscle fibers alone. Don't confuse with the attachmental site and remembering that name. Just look at the muscle and tell that where the bone is located. Anteriorly or posteriorly enough. Medially or laterally attachment, the bone is maximum enough. Okay, and examples have sent. So many people have answered very good. This one muscle have a 5 to 6 different function. We can't expect the latissimus dorsal to move only to extension. We can treat only the shoulder problem. One muscle have a 5 to 6 different function. That is where we need to understand. This muscle is not only triceps is not only helping the extension of the elbow, it also stabilizing the shoulder. posterior dislocation. It helps. And learning of the muscle attachment, half of them we need to memorize anyway, or else by looking at the pictures or name of the muscle gives some free information. Relationship to the other structure, function of the muscle, standard mode function, reverse mode function, motion I'll explain in next class because that comes on next slides. Eccentric antagonistic function, isometric stabilizing function. These are all things you need to remember. We'll discuss everything. Don't worry, guys. 5 steps up to learn the muscle. First step is look at the name of the muscle and take the free information. Second, visualize the picture of the muscle. It gives some attachmental information. Then 3 important steps. Steps on what joint it cross. It produce the movement in that joint. Next, where it cross anterior posteriorly, with that way it will move. High chance. Okay. And how it cross. This is where the muscle fiber theory comes into play. Muscle fibers oriented horizontally. Horizontally, it creates the rotation and adduction, abduction. Muscle fibers are vertical. It creates the flexion extension. Clear? This much we learn today. This much we learn today. People who want to leave, they can leave. Don't worry, you're on the spot. 1 minute, sorry. Okay, almost everyone is present. I'm happy for that. Fine. Okay. See you on the Friday morning, 6 o'clock again. Again, I'll summarize this thing. We'll need to understand in depth. Lot of things to understand. Don't worry. Okay. You go to extra class also fine. Be keen to learn. Be keen to understand the muscle. Be keen to understand the movement and everything. Okay. No one teach this. None of the anatomy book teach this. Okay. None of the anatomy book you can't take this information. Purely from the experience. Purely from
So,
the
but I think if, as an SNC coach, if I'm looking to learn anatomy now, I don't think it will be very impossible for me because this is completely logic. Even if I
Exactly.
don't know the biological names, I can just use this approach to understand where muscles are functioning. And if
Exactly.
I also treat people who have pain, so
Exactly.
this will actually help me a lot. Thank you so much.
Thank you. Thanks a lot. This is how I started with anatomical terminology. So that is only toughest things you can do effort by yourself. That is also very easy. Anatomy is not tough. So thinking tough, that is tough. Try to understand, not to memorize. Okay. Happy learning. See you Friday. Any questions? Drop it. We'll discuss.